Hi, my name is Kimberly Holst and I'm a surgical resident at Mayo Clinic in Rochester, Minnesota, and I'd like to discuss our manuscript, Septal Myectomy in Hypertrophic Cardiomyopathy, National Outcomes of Concomitant Mitral Surgery. In this project, we review the national inpatient sample experience with septal myectomies in patients with hypertrophic cardiomyopathy from 2003 to 2014. We particularly investigated the impact of concomitant mitral valve surgery at time of septal myectomy and found that the addition of mitral valve surgery, specifically mitral valve replacement, increased the risk of prolonged hospital length of stay and inpatient mortality compared to patients undergoing isolated septal myectomy. We also found that the incidence of mitral valve surgery in the national level is increased in comparison to centers focused in surgical care of patients with hypertrophic cardiomyopathy. We think that this project offers insight into the national experience with surgical management of patients with hypertrophic cardiomyopathy and offers an opportunity to explore opportunities for improvement in the care of these patients at the national level. Patients undergoing septal myectomy at specialized centers have a decreased rate of mitral valve surgery, which has been associated with improved late freedom from reoperation. One important finding for clinicians to keep in mind from this manuscript is that not all septal reduction procedures, surgical procedures, are created equal. The addition of a mitral valve replacement specifically, or any mitral valve surgery, and the addition of other concomitant procedures, coronary artery bypass grafting, aortic valve replacement, does increase both the morbidity and mortality for these patients. It's important to keep this in mind additionally when we're comparing alcohol septal ablation and surgical myectomy, as alcohol septal ablation should be considered more in line with an isolated myectomy in this series with the early operative mortality of less than 1%. We hope that the findings of these manuscripts improve patient care for those with hypertrophic cardiomyopathy undergoing septal reduction. Institutional studies have shown good late follow-up for patients undergoing isolated septal myectomy, and this, taken with the findings of this study, would suggest that the addition of a mitral valve procedure, often thought of as relatively benign, does actually increase the morbidity and mortality for these patients. It is our hope that through these findings we can continue to improve the care of patients at the national level, our experience and our understanding of these additional procedures.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.